Hello, everyone. Okay. Yeah, so as you know that I'm from Pakistan. I don't know how many of you know where is Pakistan and a little bit about Pakistan. So I'll start by telling you a little bit about the location of Pakistan. So Pakistan is bordering with Afghanistan, India, China, Iran, a complicated geography we have. And Pakistan is the fifth most populous country in the world with a population approximately 200 million.
Okay, seasickness.
Yes, thank you. So that was, I was talking about this map, and here Pakistan is. So what is the impression of Pakistan? I think talking about CNN, BBC, generally we got to hear quite a lot of horror stories, terrorism in Pakistan, particularly post 9/11. So it's true, it's not just the impression, it's the true reality. I think for the last few years it's been a little bit controlled, but we have observed many of such incidences. But Pakistan for us, for Pakistanis, is a country which is one of the topmost countries where philanthropy is like big agenda. This man, Abdul Sattar Eidi, is a man who developed Pakistan's first ambulance network single-handedly. And then we have our first woman Pakistani Prime Minister in 1988. US didn't get the chance even a few years back. And we are a country crazy for cricket. We love to hear music. We are foodie, and our biryani is very popular, and our spices. And our country, the northern part, is really very beautiful. And it used to be like a hub of tourist activities, and I believe that it started back again. So you can see from mountains to trees to desert, it's all there. So talking about the program in Pakistan, Dr. Junaid briefly talked about it. There are 3 cycles, and we are in the cycle 2016 and 21. In the first cycle, there were a total of 7 trainees. There were 4 males and 3 females. Trainees in this cycle were basically clinicians and were holding senior faculty position in the university. So they were trained for their public health degree with the concentration in injury trauma in Johns Hopkins University School of Public Health. So I would like to tell a case of trainee from phase 1, Dr. Nadeemullah Khan, who's running the show right now from the department. He's running the program right now. He was a previous fellow. So he's the only toxicologist at Aga Khan University, Pakistan, and he established this expertise through this grant. So he's taking all the toxicology cases through his phone whenever he's being called for the emergency. And he is also mentoring the upcoming students, master students in injury and trauma grants. And I mean, I believe that he's one of the like most established trainee from the case from the cycle 1. So earlier presenters talked about their impact, but I'll be talking about challenges that we faced. So from the cycle 1, I think the trainees were clinicians holding senior faculty positions in the department. So there was a constant struggle to balance research with their clinics. But again, we have the opportunity in this also because they used their clinical expertise and newly acquired research expertise in teaching their residents of emergency medicine, which is a new specialty. And people like Dr. Nadeem are needed with the background of research. So second cycle is the first cycle was in Karachi. Karachi is the southern part, and it is called the most literate city in Pakistan. So in second cycle, we aim to expand on the northern part, which is Peshawar, close to Afghanistan. So it was a little bit challenging because in Karachi, we have a nice setup of Khan University institution. We have nice programs. Compared to that, Peshawar is a little bit more challenging. The Khyber Medical University is also one of the prestigious medical institution, but their post-graduation program, particularly Masters in Epidemiology, was newer when we started our program there. So in that cycle, we had 10 trainees, 4 males and 6 females. So these were early career, and it was a mixed cohort of physicians and nurses, and they were trained both at AKU as well as in Peshawar, Khyber Medical University. So from Khyber Medical University, there were 6 males and 2 females. So I would like to go through a case of another trainee from Cycle 2 from Karachi Khan University, Mariam Lakhter. She's currently a faculty position at Community Health Sciences Department in the university. And during the training, she picked up a neglected area of intentional injuries in children, that is child abuse, which is like, I must say, it's an epidemic in Pakistan in few areas. So she took up that theme, and now that she is a faculty, she took lots of grants and published in the same field. So kind of she's the one who established this research theme within the institution. So I would like to go through another trainee, Farhad Ali, who's from Peshawar, Khyber Medical University. So he's one of the most bright students from this cohort from Peshawar. And he got few scholarships, and now he is fortunate enough because he is quite passionate. He generally calls us, gets advice from us. So he's developing injury registry in hospitals of Peshawar. So what are the challenges? So the main challenge would be the limited options of job for these cohort of people in Pakistan in injury trauma. Although they were successful in getting other jobs in other areas of research, like other NCDs or infections, but there were very few who are like have options to do their work in injury trauma. But those who switched, who are not directly part of injury and trauma, even they are linked by us, by our department, emergency medicine. So whenever we see any topic which is close to that individual, we'll link that individual. And they are also teaching and mentoring the upcoming students and clinical residents. So now the third cycle, we introduce the doctoral program in injury and trauma in our institution. So we are able to recruit 3 male students, 2 masters from Afghanistan. So now this cycle is actually expanded to Afghanistan. So we look beyond Pakistan. So there are a few challenges here again. Recruiting a female participant from Afghanistan is a challenge for us right now, but we still are in a phase of recruiting more. So we are hoping that this year we might get at least 1 female participant. And then the opportunity in this cycle is to get a clinician who is doing his doctoral from our institution. So clinical scientists are really very rare domain in our country. So I think it's very positive. And then we were exposed to so many things like annual emergency medicine conferences, where every year we have a special theme, including injury, trauma, and disaster. And we were able to establish other things like violence and injury prevention monthly seminar series, where we invited speakers, although it's also a difficult task to find a relevant speaker on the field in Pakistan, not whole Pakistan, particularly in my institution, but we were successful in doing like for 2 to 3 years. And then we developed few courses on injury prevention and control. There was none before the Fogarty program. So we developed 2 courses for master's program in our university, and there are a lot of short courses. And now this is the more recent development. We have established 2 research groups relevant to this theme. One is violence and injury, and the second is child protection research group. So coordinators of the program, so over 12 years we had success stories of so many coordinators for this program. There are at least 4 coordinators, and due to exposure to all those activities, at least 3 of them are dedicated to trauma and injury, while others are volunteering to contribute in capacity building. They at least 4 to 5 are getting enrolled in best public schools of world. For example, Harvard University, Johns Hopkins University. So in my conclusion, I would say partnerships are there to build a career, particularly if they are for long-term partnerships and sustainable approach. Engaging the trainees, even when their the cycle is finished, is a key for partnership. And buy-in of institution is also important. So outcome from this program had led to so many benefits, particularly to the staff, to the department, to the care of the patients, and to the wider research agenda of the institution, country, and region. Thank you.